Hello, good morning. Can you hear me? Perfect. Good morning, good afternoon, dear colleagues, dear friends, and dear participants of the World Health Summit. Let's start the session. The session is about leveraging the Global Action Plan for Sustainable Development Goal number 3, achieving healthy lives and promoting well-being for all at all ages. My name is Soraya Dalil. I am director for the special program on primary health care with WHO Geneva. With me in this panel, there's a distinguished panelist from around the world, from few countries, also from the Global Action Plan Secretariat. Colleagues who are with me as panelists, very distinguished colleagues, they are Dr. Fauzia Abikar Noor, Minister of Health and Human Services for Somalia Federal Republic. We have Mr. Mohsen Zada Ghafar Mohsen, First Deputy Minister of Health, Ministry of Health and Social Protection, Republic of Tajikistan. We have Dr. Malik Mohammad Sofi, Director General Health, Ministry of National Health Services, Regulation and Coordination, Pakistan. We also have Dr. Patrick Komo Abuegi, DG of Ghana Health Services. And we have with us Cecilia Luduno Sino, Founder and Executive Director of Hope for Future Generations from Ghana. So colleagues, we also have colleagues, Ms. Isadora Quick from the WHO Host Secretariat of the Global Action Plan with us. We will have this panel for the next 90 minutes. I give the floor to Isadora Quick to introduce the Global Action Plan, and then we will get to our panelists to hear from them. So Isadora, you have the floor.
Thank you very much, Dr. Dalil. I will share my screen. Okay, great. Can you see my slides? Yes, great. So good morning, Excellencies, ladies and gentlemen. In the next few minutes, I will briefly present the Global Action Plan for Healthy Lives and Well-being for All. And I will also highlight some of the key messages which are included in the 2020 Progress Report, which was published last month. So I don't know why it's not sharing. Okay, yes. So I'd like to start by highlighting the ultimate goal of the Global Action Plan, which is really to accelerate progress towards the health-related SDGs, leaving no one behind, including in the context of countries' efforts to recover and rebuild from COVID-19 through a partnership of 12 multilateral agencies. So country-level results are really at the heart of the Global Action Plan. The SDGs are first and foremost achieved by countries, and the Global Action Plan aims to better support countries to do so by strengthened collaboration between the signatory agencies. So the Global Action Plan unites 12 multilateral health, development, and humanitarian agencies. It was launched in September 2019 at the UN General Assembly. And although these agencies do represent, although these agencies are not the only ones active in the field of health, they do collectively represent 1/3 of development assistance for health annually. Through the plan, agencies are committed to better align their ways of working to provide a more streamlined support to countries and move from complementarity to synergy. The signatory agencies recognize that many collaborative efforts are ongoing. So the Global Action Plan doesn't want to duplicate any of these efforts or to create parallel channels for collaboration, but really to build on those existing successful mechanisms and initiatives and strengthen them. The implementation of the Global Action Plan is based on 4 key commitments, which are to engage with countries to identify priorities and plan and implement together, to accelerate progress in countries through joint actions on under the 7 accelerator areas, to align in support of countries by harmonizing operational and financial strategies, policies, and approaches, and finally, to account by reviewing progress, learn together, and enhance their shared accountability. The 7 accelerator areas were identified by the signatory agencies as catalytic areas where increased collaboration could really have a concrete impact at country level. And these are primary healthcare, sustainable financing for health, community and civil society engagement, determinants of health, innovative programming in fragile and vulnerable settings, including for disease outbreaks, R&D, innovation and access, and data and digital health. The signatory agencies also committed to ensure gender equality throughout their work on the Global Action Plan. Let me now turn to the 2020 Progress Report. This was the first progress report on the Global Action Plan. It was published last month, and it really presents early empirical evidence of the progress achieved. It focuses very much on the learning by doing approach, which the agencies used in this first year of implementation. And it shows how the agencies have moved from commitment to action. It also really highlights that the Global Action Plan is grounded in country support. It includes 5 country case studies, and we will have the opportunity during this next panel discussion to hear from some of these countries and hear about their experiences. The progress report also shows that working groups have been established for the 7 accelerator groups and for the cross-cutting commitment on gender equality. It really describes how the Global Action Plan has increased mutual understanding and trust between the agencies and has led to the establishment of communities of practice. But it is also quite honest about some of the challenges which have been encountered by the agencies during this first year. Notably, the need to continuously strengthen and incentivize collaboration through a stronger institutionalization among the agencies. But also, for example, the need to sharpen the accelerator's focus, particularly in light of the COVID-19 pandemic. It also describes the need to increase transparency and accountability, and particularly to strengthen the future engagement with civil society. Concretely, the agencies have been engaging with countries. The engagement with countries has occurred primarily through 2 accelerators, primary healthcare and sustainable financing for health. And again, this next panel discussion will allow us to hear from some of these countries. As I mentioned, accelerator working groups are up and running. Agencies are working to strengthen their alignment. So for example, they have developed an operating model. They are working to institutionalize the new ways of working inside their own agencies. And also they are having discussions to ensure alignment between the Global Action Plan and the broader UN reform process at country level. And finally, they are accounting for their work and their progress. And this progress report, of course, plays a big role in that. But the signatory agencies also have led a joint evaluability assessment, which will really strengthen their accountability and will pave the way towards the 2023 independent evaluation the agencies have committed to do. And finally, the knowledge which has been acquired by these agencies in the SDG3 is being transferred to other SDGs, such as, for example, for the acceleration framework for water and sanitation. So this was a very short overview of the Global Action Plan and its first progress report. I thank you very much for your attention, and I give the floor back to Dr. Soraya Dalil.
Thank you, Isadora, for a very good overview of the Global Action Plan SDG3. I now open the floor to the distinguished panelists. And in this panel discussion, the first round of panel discussion, we will concentrate on the COVID-19. We would like to hear your broad perspective on how COVID-19 has impacted the national trajectories toward achieving the SDGs, and in particular the SDG3. What is needed to accelerate progress on the health-related SDGs, and where would closer collaboration of the multilateral agencies be most impactful? I would like to give the floor first to Honorable Minister Dr. Fawzia Abikar Noor, Minister of Health and Human Services, Somalia Federal Republic. Let me introduce Dr. Fawzia Abikar Noor. Dr. Noor has studied law. She has a PhD in public health, and she has a very unique profile bringing together public law and public health and human rights. She has been the Minister for Health and Social Care for the federal government of Somalia since March 2007. Dr. Fawzia Abikar Noor, very welcome to this session. Assalamu alaikum, you have the floor.
Thank you so much, Madam Chair, Dr. Soraya. A very good morning to all the participants. Good morning to Director General, Dr. Tedros. Thank you so much for the question, Madam Chair. In a fragile health system, the impact of COVID-19 has only started to emerge. It would take few months and perhaps many years not only to understand how this is pushing back our progress towards the SDGs, but how the pandemic has been a real global realization that we can only as strong as our weakest links, and if we can make progress in fragile, vulnerable, and conflict-affected countries, we can win again health, development, hunger, and poverty. In Somalia, what we have seen is that the health interventions, which could have had high impact on attaining the universal health coverage goal in the SDGs, have suffered most. As a result, our trajectory towards reducing the under 5 mortality rate, the maternal mortality ratio, and our vision for achieving universal health coverage by 2030 will all be halted and pushed back. The current projection in my country is that the life-saving vaccination coverage, which is already very low, might drop by 20% at the end of 2020. Facility-based delivery will decrease by 4%, and child mortality can increase by 13%. If these estimates hold true, we will miss thousands of children from life-saving vaccines at the end of the year. Thousands of children will suffer from acute malnutrition. Many pregnant women will be denied access to antenatal and postnatal care, and we might see unnecessary deaths which could have been avoidable. In a country where children are about 16.5 times more likely to die from the age of 5 than children in developed countries, and the lifetime risk of maternal death is 1 in 20, which is one of the highest in the world. As a Minister of Health, this is a huge concern on me, how we will recover from the secondary impact of COVID-19 in Somalia. I therefore throw back this message to all of us today, which I believe in my heart. Protecting health of vulnerable countries is not a choice. it's a moral imperative for all of us. Thank you.
Thank you, Minister Abikar Noor. Great message about protecting the life of vulnerable people, including women and children in fragile settings, are moral imperative. And the pushbacks with regards to the journey toward the SDG3 and overall SDGs. We have heard your concerns and your remarks. Thank you. The next speaker is Deputy Minister Mohsen Zada Ghafar Mohsen from Tajikistan. Mr. Mohsen Zada is Doctor of Medical Science. He has vast experience in clinical care, management, and policy. And it's great to have him in this panel today. Deputy Minister Mohsen Zada, you have the floor. We cannot hear you. Please unmute yourself.
Sorry. Honorable ministries and guests of this virtual meeting, I would like to thanks all of you to actively participating on this very important virtual mission. While the impact of the pandemic will vary from country to country, it will most likely increase poverty and inequalities at a global scale, making achievement of SDG even more urgent. The Republic of Tajikistan, along with other countries in the world, is affected by this unprecedented pandemic. Even with breakthroughs in treatment, testing, and vaccines, transitioning towards a steady state of low-level transmission will leave a difficult legacy which will make achieving the SDG more and more challenging. What Tajikistan is doing to ensure provision of essential health services during the pandemic and how GAP agency best support efforts. Tajikistan's already weak healthcare system makes the task of constraining COVID-19 even more challenging. Ministry of Health and Social Protection of Population refocused its overall health strategy to effectively respond to the COVID-19 health crisis by improving surveillance, testing, and case management while ensuring that essential health services are not disrupted. There is a need to maintain essential health services, especially for life-saving interventions, immunization, communicable and non-communicable diseases, maternal and child health, care for older people, mental health, as well as prevention and rehabilitation. The cross-border nature of the economic, environment, and social problems further reinforces the importance of utilizing intersectoral mechanisms, as well as legal instruments to tackle health-related issues and deliver on the SDGs. International development partners are essential in supporting the cross-border aspects of health protection and promotion. United Nations agencies and GAP partners, well as the European Union, bilateral agencies and non-governmental organizations are all active in Tajikistan and participate in forming the strategies for the health sector for 2020 till 30. Tajikistan is one of the countries selected for the specific focus on health financing reforms as an accelerator to achieving SDG 3, creating A viable system for sustainable health financing is an area where progress has been slow, but momentum has increased in recent years. In addition to the focus on sustainable health financing, Tajikistan is also prioritizing the following GAP accelerators: primary healthcare, innovation and access, particularly in health management information systems and data management, and development of healthcare workforce. Health system response to modern challenges requires innovative solutions that are focused on the end users and are systematically based on sound evidence and are as resilient to economic cycles and possible. Well-coordinated, people-centered health systems ensure better health outcomes, patient and provider satisfaction, and financial sustainability. Tajikistan will work with WHO Euro to transform our health systems to strengthen key elements in such system that include good governance, health literacy, patient and health worker empowerment, motivating and building the skills of the health workforce, equitable financing models, and access to essential medicines. Harnessing the potential of digital technologies and data-driven innovations such as big data and artificial intelligence is a key aspect of this. From now on, quality resourced, strong and sustainable health system that prioritize people's needs and dignity will be our gold standard. Thank you for your attention.
And thank you, Deputy Minister Mohsen Zada Ghafar Mohsen, for a very great remarks. Cross-border aspect of the COVID-19 with regards to health promotion and health protection, as well as your emphasis on people-centered health systems and services. We have also heard your voice about the engagement with the sustainable health financing in Tajikistan with regards to equitable financing modules, and also your willingness to engage with a number of other accelerators, including on primary health care through the Global Action Plan. Thank you. The next speaker is Director General of Health, Dr. Malik Mohammad Safi, Ministry of National Health Services, Regulation and Coordination for Pakistan. Dr. Malik Mohammad Safi is a medical doctor. He has a vast experiences in public health systems and worked in all three tiers of the Pakistan health system. He is currently engaged, or in fact leading the policy formulation at the federal level with a specific focus on achieving universal health coverage. Dr. Safi, you have the floor. It's great to have you. Please go ahead.
Thank you, Dr. Suraya, for these kind remarks and welcoming myself. Honorable Ministers, since this pandemic started, just like across the globe, it has a very negative impact on Pakistan's health systems, and as well as thereby the trajectory towards the SDGs. Country is facing three types of major challenges as a result of COVID epidemic. First one, loss of life and well-being. Number two, loss of job opportunities for our labor class and pushing them towards poverty. And three, slowing down the economy. These were three key areas which we had the impact. So this has in fact and there was a steep decline in economic growth rate and rising level of poverty across the country. After almost 70 years of Pakistan, we are for the first time having a negative economic growth, minus 0.04%. But thanks to our whole of the government approach, which government adopted, led by the Prime Minister, it was a very well coordinated effort across the country, and we were able to have an early decline in the epidemic curve in Pakistan. And we are hoping to have some improvement also in the economic side as well. So impact on health has in other countries, in Pakistan too, it remained very serious. Almost 8,000 plus we lost lives, and around 350,000 affected. And it has put a lot of burden on weak health systems in Pakistan. Moreover, almost 8,000 healthcare workers got affected, and they were under mental stress, and almost 100 of them lost their lives, majority of them doctors, followed by nurses. As a result of this pandemic, the essential services as hospitals and those were more focused on COVID. So essential services also declined, especially communicable diseases, managing NCDs, RM and CH, in which especially women and children were affected, antenatal care, EPI coverage reduced almost to 30%. We had to stop the polio campaign as well. So these were very critical times in which our children suffered, and it is we have almost estimated that around 1,000 maternal deaths have occurred due to this, and almost 45,000 children have died. Moreover, impact on rising communicable diseases was there. So mitigation measures were also put in place. These measures also helped in reducing measles, diarrhea cases, dengue cases. So they are less than what we usually expect during this season. So due to the result of children staying home and smart lockdowns. So alternate service delivery options were there, like digital technologies, telemedicine. So that helped in reaching out to those which we couldn't. So the pandemic usually this time remained within the urban areas. Rural areas were not affected. So that led to the government more focus on urban sites. And that's how, and moreover, government also provided financial assistance to the people living below poverty line to ward off their urgent needs. And smart lockdowns were initiated after complete lockdown, so that the labor class could have their some work, and they can feed their families. So definitely it was a difficult time, but let's hope with the collective efforts of partners at global and regional level, so we will be able to manage this. So thank you very much.
Thank you, Director General Dr. Sophie, for a great remark, realities from the ground about Pakistan, the loss of lives, the loss of livelihoods, and the impact on economy and the negative growth for the first time in the history of Pakistan with regards to the economic growth. You also highlighted very importantly the impact on health workers, especially on the frontline health workforce, who are very critical in maintaining essential health services, as well as responding to COVID and care for the infected cases and so on. So I'm sure we will get back to that. We have our last speaker for the first round of questions is now, she is Ms. Cecilia Lodono Sino, founder and executive director of Hope for Future Generations in Ghana. Ms. Lodono Sino is a public health nurse, a midwife, and a social worker. Her NGO focuses on women and children with an aim to uplift them through transformational processes that will empower them and putting them at the center of decision-making at the community level. She is the president of the non-state actor for health and development and works to promote her goal of an independent, strong, and sustainable civil society organizations platform in Ghana and across Africa. Cecilia, welcome, and you have the floor.
Thank you very much. I'm so grateful to be given this opportunity to share. Honorable ministers and dignitaries, as all other countries experience COVID-19, definitely impacted negatively on Ghana's health system, bringing pressure on the existing facilities, which were already not adequate to meet the health needs of all Ghanaians. Our first two cases were reported on March 12th, but as at August 15, 2020, Ghana had recorded 42,653 cases. Data is available on Ghana Health Service website. Over 47,690 people who got infected with COVID-19 as at October 21st, though over 46,000 recovered, had a bridge on their healthy lives with 316 deaths and 487 people still infected with COVID-19. Among all the interventions were those that directly affected the health system, strengthening and expanding COVID-19 response, risk communication, motivating frontline workers with incentives to ensure they are emotionally positioned to respond to COVID-19 cases, investing in PPEs for medical personnel and expanding infrastructure and increasing commodities, especially in tracing infections and testing. Increasing spending on health since February 2020, therefore, has focused on COVID-19. And this has led to a reduction in spending in other areas of health. I take, for example, drugs and other commodities for HIV, TB, and malaria. By mid-July, some facilities in the country have reported shortage of ARVs, including pediatric ARV. This necessitated visits to regional offices and engagement of regional and national level duty bearers on the need to ensure the availability of ARVs since they are life-saving drugs. Through our community-based monitoring feedback system of the community system strengthening under the Global Fund Module 2, we also realized that screening and testing of sputum for TB was problematic since there was reported shortages of containers for TB sputum collection. And TB testing also became secondary because all attention were on COVID-19. So yes, there has been a shift from other areas of disease to COVID-19, and over 47,000 people have suffered from ill health because of COVID-19. Ghana's efforts to achieving SDG3 has therefore been adversely affected. What is needed to accelerate progress on the health-related SDG? Government needs to continue to increase domestic funding for health in the area of COVID-19. it makes sense to invest more to ensure that the pandemic will not have devastating effect on the country, and government has done well in this area. But we would like to call for a focus also on the existing life-threatening diseases like HIV, TB, and malaria, so that in the efforts to overcome COVID-19, other problems are not created because of neglect of investment in other areas. Where will closer collaboration, the multilateral investment into commodities and drugs, research and capacity building of health staff, and work closely with civil society and community-based organizations to bring community context to bear. Thank you very much.
Thank you, Cecilia, very much. There was some echo when you were talking, but we tried to listen carefully and capture your main points. Thank you for reflecting the voice of people from communities with regards to the shortage of essential medicines, community-based monitoring and surveillance, including screening for the communicable diseases during the pandemic. We get back to you, and please stay connected. Before we go to the second round of questions, I would like to say that we have around 45 participants connected to this session. We also have a chat Q&A facility, so please write your questions and remarks, and also say who from the panelists you would like them you would like the comment to go to. So we, in the second round of this interaction, I would like to invite you to engage with regards to your expectations of multilateral support. Global Action Plan, SDG3, has been a multilateral mechanism bringing 12 humanitarian development and health agencies around health and well-being. So we would like to hear from distinguished panelists about the expectations you have from this multilateral support, and how best the GAP can support your national leadership in your settings. Have you seen changes in the way the agencies collaborate and support your leadership in the past year? How would closer collaboration support your priorities concretely in light of the GAP commitments? And what steps are needed to make the positive developments permanent and sustainable in the countries? I know the challenges are huge. We are at the midst of a pandemic, maintaining essential health services, responding to the COVID epidemics, and so on is a great toll on our society, on our system, and on our services. But I would like you to focus on your expectations from GAP, and we would like to hear that. Minister Abikar Noor, would you like to start? You are on mute.
Thank you so much. The agencies, Madam Chair, thank you so much. The agencies have their own individual mandates and commitments. It's important for these agencies to understand the health priorities are owned, developed, and driven by the government, which are in the best interest of its population, they said. Therefore, the agencies need to align their actions in support of the government and engage in a way that the government's mechanism and structure for achieving the health-related indicators of sustainable development goals and the government's mechanism for multi-sectoral and multi-donor coordinations are not fragmented or weakened. This is a work in progress. I'm hopeful and optimistic. We are increasingly understanding that improvement of health is a shared responsibility of the government and the GAP agencies in fragile and vulnerable states. The government should be steering and driving this agenda towards, while the agencies should align and engage their actions in a collaborative and complementary manner. In the areas of immunizations, control of infectious diseases, preparedness and response for epidemics and health emergencies, and in recent time for the COVID-19 response, there are clear examples of GAP agencies aligning their actions in support of the government-led initiatives. There are also areas that need improvement, such as coordination with the government, alignment with national priorities, and support of institutional capacity development, to mention a few. We need to do more to move away from a compartmentalized and vertical disease-specific control program to a more holistic approach that is aimed at building strong and resilient health systems. This is something that we should strongly advocate for the GAP agencies to do more on this front. WHO, being the UN Health Agency responsible for SDG3, should take more proactive role among the GAP agencies to ensure that the spirit of better collaboration and cooperation that underpin success for improving better health in developing countries are institutionalized. I would reiterate by calling upon the GAP agencies to work closely with the government by pre-aligning, pre-adjusting, and refocusing their support to the implementation of the essential package of health services. This way, decisions can be taken on the best and effective use of resources and to achieve the greatest impact at low cost in countries like Somalia. Thank you.
Thank you very much, Honorable Minister. Great points. Aligning actions, improve coordination with government, follow the priorities of the government, and you also underlined the shared responsibility. I think that's very, very key to our discussion, shared responsibility between government, the international community, the agencies toward health. As we have seen, health is a driver, but also an outcome in the development journey. Thank you so much. Now, I would like to give the floor to Deputy Minister Mohsen from Tajikistan to share his expectations from the Global Action Plan. Deputy Minister, you have the floor.
Thank you very much. I'm extremely pleased to let you know that the Republic of Tajikistan has been selected as one of the global pilot countries for the national implementation of the Global Action Plan for Health, Lives and Well-being. My country is having a range of priorities in health and development. It is critical that infant, child and maternal care is strengthened further in order to reduce mortality rates. We further need to reduce our communicable disease rates, including HIV, AIDS, and tuberculosis. Cardiovascular diseases are are an issue, being responsible for over half of the deaths in the country. Injuries and accidents continue to bother us. Let me thank here the WHO Regional Office for Europe for their support provided. We were able to deliver a progress report on the achievement on health-related SDG targets in Tajikistan. The three main recommendations were that to improve health and well-being, we need a strong health system, properly financed with a highly skilled workforce and a strengthened primary health care. I'm therefore very grateful for the discussion and support by the GAP partners and the European Union on strengthening health financing as an accelerator towards achieving Sustainable Development Goal SDG3 on health and well-being for all. Thank you very much.
Thank you, Deputy Minister Mohsen Zada, about the emphasis on properly financed health system and skilled health workers and building health systems based on primary health care. The next speaker is Director General Dr. Malik Mohammed Safi. Dr. Safi, your expectations from Global Action Plan. Please go ahead.
Thank you once again. Well, Pakistan did several things to ensure that the provision of health services are ensured during this pandemic, and we seek support from partners. And so in this context, Pakistan has been regularly monitoring the coverage of essential health services and accordingly taking mitigation measures. As earlier stated that during this COVID, usually our urban area was most affected and rural areas remained not that much affected, and normal life was there. Almost 60% of Pakistan lives in rural areas. So there the PEC services remained. However, the worst time was the month of March till May, when essential services declined rapidly as a result of complete lockdown, especially in urban areas. So when we moved on towards smart lockdowns and opened up a few areas, so the health systems then started functioning to a larger extent. The outpatient department, and usually we focused on to open up the maternal child health centers, operation centers in order to address the urgent needs. The country during this period, we utilized extensively the digital technology for provision of essential service delivery approach, like telemedicine, and all these aspects were taken into consideration, even for training purposes, for care, mental stress, and training of our technicians for on various aspects. So they were carried out through the digital aspect, digital things. So private sector during this also played a key role in service provision. Though the general practitioners, they got quite ill and but despite that, they played their role, and in providing of essential services. Uh, During this time, as earlier stated, vaccination services was a difficult aspect, and EPI coverage dropped. We had to close down the polio campaign as well. Also, availability of contraceptives at the health facilities, it was a challenge, while demand across the country is rising with risk of abortion care. So EPI and polio being an endemic country, so gradually we have now resumed those services in providing special care to our frontline workers who would be providing EPI vaccination and polio drops, and also at the primary healthcare who are serving. Moreover, with the support of WHO and Bill and Melinda Gates Foundation, we have been able to finalize and got endorsed the universal health coverage package for community primary health care and first level care facilities. So this was a great breakthrough for us, and this would serve as a in continuity of essential services, basic services across the country. And through this, we would be addressing much needed need. For GAP agencies, definitely, as Honorable Minister for Somalia pointed out, that every agency has its own agenda, and according to that, they have their work plans and finances aligned. So what government has requested, there's a donors coordination forum at the national level, and through that we try to align all the support, so that in order to avoid duplication of services and provision of support, and we request that this is the priority area, and similarly we would request all the GAP agencies for aligning their support to government priorities, and we share our priorities time to time with all of our partners. And now that we have our universal health coverage package with us, so we have requested all of our GAP partners and civil society to engage and align their financial assistance towards this, so that there's a harmonized approach and we are able to cover the gap. So in this context, we have also engaged a global financing facility, and the partners are there with that, and other bilateral, we are also engaging countries who are supporting Pakistan. So this is how we see that GAP could support best and serve the health systems and improve the health indicators of our country and enable us to achieve the SDG agenda. So thank you very much.
Thank you, Director General. Sophie, speaking about the UHC package in Pakistan, the alignment, harmonization, and focus on results, and stressing on agencies' better coordination and alignment behind the priorities set by the government. Now the floor is with Mrs. Cecilia Ludunu Sino. Cecilia, you participated last year in the Health Financing Forum, November last year. The question is, have you seen a change in the way the agencies collaborate at the country level? And looking forward, how could the agency jointly better engage communities and civil society representatives in their efforts to support countries accelerate progress?
Thank you very much again for this. Yes, I participated in the health financing in November last year. And a lot of focus has been on domestic resource mobilization, country ownership, country-led. And it is very important that this actually translates in all the interventions, especially our priorities as a country. The multisectoral and multisectorial and the various partners continue to align with government of Ghana, providing technical support and resources and direction. I still think that we have gaps, and then expect that those gaps must be filled, looking at it holistically, but again, calling on country ownership. When you look at the GAP or Global Action Plan framework, I think the engagement continues, but I see limited engagement of civil society and communities. A lot of focus is engaging government. Yes, we agree that that is important, but the community actors are very key. And I think that is one area that we need to strengthen our engagement so that community voices, beneficiary voices can also contribute to the holistic approach of what we are looking at. It's still important that we continue to look at acceleration of progress made so far. Yes, we are moving on and a lot is being done, but alignment, integration is very important so that we focus on limited resources, align and integrate what we have. As a civil society person, we believe that accountability is so very key when we are talking about this. At all levels, not only at government or political, but even at the community level, is very important. Closer working relationship and working and engaging private sector is very important, as we believe that private sector is also great contributor to development in our part of the world. I believe, or we believe, that massive investment and strengthening of our health system. Yes, we agree that we have fragile health system, but community systems are also very key as we focus on health system to ensure that communities are also strengthened. As multi-sectorial partners continue to support and invest, prioritizing the needs and aligning with the country policies and structures is very key. I believe, and we believe, that country ownership, resource allocation, and resource mobilization from the country is very important, and it will ensure sustainability of the achievement that we have made and we continue to make so far. So far, I think that there has been a lot of collaboration with government of Ghana, and this is what I have to contribute. Thank you very much.
Thank you, Cecilia. Accountability at all levels is key for success. And in order to ensure that development is sustainable, we have to make sure that it's owned by the country and it's owned by the communities. They are a main stakeholder in healthcare provision and producing health and developing health and self-care, and then also ensuring accountability for decisions about health and development. Within the accelerators, like Isadora at the beginning of the session shared, there are 7 accelerators, and one of them is communities and civil society. Yeah. So the GAP in its structure has envisioned the community and civil society as a stakeholder, as a main partner, and there's an accelerator for communities and civil societies engagement. Colleagues, we have half an hour left. We do not have a representative from Ministry of Ministry of Health of Ghana yet. He may join us later, we'll see. I want to open the floor to comments and questions from the participants. We already have one comment. We already have one comment in the chat box, and that's the following. Given limited amount of donor funding available for health, what would be the best use of those funding available? This is a question to all panelists. So actually, economies are contracted. We heard in the panel that the economic growth has been severely affected. So in that situation, how we make sure that we use the available resources in the best way possible? This is one question. Please feel free to answer that. The second question is for Dr. Safi, and that's about whether there is a specific data available comparing the COVID-19 caseloads and mortality between urban and rural communities in Pakistan.
I can answer to the to the first question.
Yes, please.
In low-income countries, where we always feel the lack of resources, the most priority is reforming, changing, and improving primary health care, which become a key element especially in prevention, detection, and fighting against COVID-19. As Tajikistan shows, our experience shows, when we change our approach from hospital-related issues into the primary care and into the prevention and into detection and working in society, we, within 1 month time, within 4 till 6 weeks, the health sector in Tajikistan allowed to decrease the load to the hospitals from 5 to 10 times. And now, after 4 months after pandemic onset, we already see that only maybe 8 to 10% is hospitalized. All patients are at homes, isolated, and we organize home care for those patients. So they're extremely happy to see that with efforts, with limited resources, can improve enormously the health of the society, the health of people. So this, I would like to strengthen that in low-income countries, in any countries, to rely on the shoulder of primary healthcare is the best approach and best element to fighting and attracting additional resources to strengthen this. Thank you very much.
About this, if Dr. Safi is here for responding to the data asked about rural and urban. So right now I can share that detail as well. If we have 7 sub provinces with us, and I have the provincial distribution of deaths, we can have a good idea. Most of the burden which came, it was on larger cities like Karachi, Lahore, Faisalabad, Peshawar, now Islamabad, and these were the main areas which were hit due to congestion and frequent interaction, lot of economic activity. So accordingly, the deaths which occurred, the mortality distribution amongst the 6,000 plus, 39% was in Sindh, 35% deaths occurred in Punjab, while KP, the Khyber Pakhtunkhwa near Afghanistan, 19% of deaths, and Islamabad 3%, and rest of them fewer. So similarly, our major urban centers, the infections were there, and I'll be happy to share via email the detail of that. We have it in our IDMIS data bank. But the second wave which we are expecting, if that comes, and we are also focusing on our semi-urban and rural areas, preparing their response so that, in case our rural areas get infected, so we are able to ward off that disease. So for time being, thank you.
Thank you, Dr. Sophie, for the breakdown and for the data about the different areas in Pakistan. There are two more questions. The first question is, what role does primary healthcare play in your strategies to achieve the health-related SDGs? The role of the primary healthcare. Second question is knowledge shared timely with governments and agencies on what is advancing SDGs and ways to mitigate barriers? I repeat the second question. Is knowledge shared timely with governments and agencies on what is advancing SDGs and ways to mitigate barriers?
So I can go ahead with one of the responses from Pakistan.
Yes, please. Yes,
about
please.
Role of primary care and how do we prioritize. So as earlier stated, based on the burden of disease and mortality and morbidity which we are facing, uh, since last 7 decades, our health systems, though it's a very innovative health systems, most of the funding has going 70% of it to the urban side, and rural area primary healthcare has remained undersupplied for the HR, essential medicines, medical technologies. But now things have changed, and now focus is more on community and primary healthcare, strengthening first level care facility, strengthening in order to provide basic essential services near to the place where people live. So that's why ministry has, in collaboration with all the provincial governments and partners, we have defined this universal health coverage benefit package based on disease control priority 3 program. And we would be now starting its implementation in a phased manner across the country with the support of partners and with domestic funding as well. So yes, we do consider primary healthcare as the linchpin and the cornerstone of our new agenda and policy for managing mobility and mortality within our country. So over to you.
Thank you, Director General Safi. Deputy Minister Mohsen Zada, would you like to add on primary health care? I think your remarks on primary health care was very important. Would you please tell us more on your priorities in supporting primary health care and building a strong primary health care, please?
Thank you very much for giving me a floor. Primary health care, which this is a, we have in a transition from disease-oriented care into the approach where we more exercise on prevention and detection and screening. So on this regard, we have quite a huge reform process of strengthening primary health care, which that we share the experience of other countries, and now, especially in COVID-19, it showed that it is very important to rely on primary health care. Primary health care allowed us to, using limited resources, with especially in rural area, to send this resource on those areas which is more fragile, where we have target population, which is more under COVID-19 spread threats, and there we located all our resources. And with this, on the area where we can detect primarily all these cases, isolate the cases, and organize primary care treatment, which allowed us to prevent further spreading of these diseases, to prevent unnecessary load to hospital care. And since peak of pandemic, since May of this year, already till now, end of October, I think we reached a sustainable approach, which further we would like to sustain it in the atmosphere of increasing seasonal diseases. And we always relate on, send these resources onto only on target population, because we cannot mobilize the whole resources. So I think to concentrate and mobilize resources on the area where less access, poor people, where we have more problem. By this, primary health care is a key element of care for all. Thank you.
Thank you. We have another question from participants, and the question is about innovative approaches. What can we learn from innovative approaches deployed as part of the response to COVID-19 to help countries get back on track for the SDGs? It's a very good question indeed.
I can share with the experience of our country in Tajikistan. We, of course, without digital technology, without having digital system support, we cannot move further. When everything was put in the database system, especially primary testing for COVID-19, which goes to the mapping further, and we can distribute and put in the areas which is more problematic. By this, we already can locate our resources and to mobilize them and to achieve better results. We have a lot of mobile companies. We combine online, for example, surveillance together with patient care by presence, physically presence of the healthcare workers. All this allowed to do this work much better and with very fast, with losing less time, and of course, on prevention side, when you can prevent a lot of consequences, a lot of complications like cardiovascular system, like when you using this data system, we can always find the patients who has a lot of concomitant diseases, who is aging, mother in care, for example, pregnant women. This all allowed to use digital technology to improve healthcare. Without this, we cannot imagine how we could help without this. Thank you very much.
Thank you. Thank you. I do not see more questions. I think we are done for the time being with the comments and questions. We have 12 minutes left for the session, and let me summarize the points that was raised in this panel. I think all of us around the world, we and also panelists in this session, we agreed and we stressed on the fact that the essential health services, life-saving vaccinations, maternal and child health care, reproductive health care, RMNCH, they all have been affected in this protracted pandemic. The moral imperative to focus on people who need most of attention, including those left behind, vulnerable population, displaced people, and people living in poor communities were raised. The cross linkages between economic, environment, and health, as well as cross-border aspect of the COVID-19 with regards to health promotion and health promotion, was raised. People-centric health system and services, and people-centric health system and services takes us to the primary health care. We saw clear examples on focus on primary health care from Pakistan, from Tajikistan, and from Somalia. The UHC benefit package is very much focused on primary care, on the first contact between the system and the communities. The essential package of health services in Somalia is also designed around the primary health care, including the primary health care approach, equity, and people-centeredness. And with regards to Tajikistan, I think the message was very profound, that we need to shift focus from disease to health and looking into health from a holistic, integrated, and comprehensive perspective. And the fact that primary health care makes the health system efficient, effective, and equitable. With regards to innovative approaches, again, COVID-19 has disclosed a lot of opportunities, including use of digital technologies, mobile telephone networks, combination of surveillance with patient care and self-care, empowering individuals to take care of themselves and also take care of their loved ones and families. And with regards to increased burden of NCDs, the promotion, protection, and prevention aspect is becoming more important. So that's it. Okay. I have another final question from dear panelists, and that is, what would be the single most impactful intervention or change in the way we agencies and the multilateral agencies within the GAP platform that we work, what is the single most impactful intervention or change in the way of working the agencies could help you in your role in the countries? Any change you want to suggest the way we work? I think it's a bit complicated question, and but if you have anything to add and to say, please feel free to use this opportunity. Cecilia, you are still with us. I see that you are still connected. Do you have any final say?
Yes, thank you very much once again. I believe that strong involvement of communities, bringing their voice to bear, and community-based organizations is very important, because they are mostly the users of our services, and they must be involved and understand. They must be empowered, because if they are empowered and they take the responsibility for their health, I think resources at community level, more investment at community level is very important. Then we can move forward as a country. As it stands now, decisions are taken for them. But I believe that their involvement and their engagement, empowering communities, community structures, community voices, civil society organizations who are directly in touch with the people is very important to accelerate progress. Thank you.
Thank you, Cecilia. I think that's a very powerful message to close with. Community engagement, community empowerment, in providing care, in ensuring care, and ensuring well-being is critical. And I want to add on that and say that the primary healthcare approach includes community engagement, or it systematically acknowledge and empower communities to be part of the decision-making for healthcare, not only as a recipient for healthcare, but also as co-producer, co-developer, and co-advocate for care, advocating for financing, advocating for accountabilities, and so on. So I think we are coming together very closely in terms of the primary healthcare, community-based services, where communities have a greater role as a co-design in health. And that's part of the primary healthcare approach. Distinguished panelists, honorable ministers, DGs, deputy minister, thank you very much for the time, for the candid discussion we had. I enjoyed this session, and I wish you enjoyed too. I also see that we have more than 30 participants still connected. I thank them for their interest and for the questions that they have put forward. Thank you very much, Cecilia. We wish you all the best. Have a good day, and assalamu alaikum.
Thank you.
Assalamu alaikum. Thank you very much. Thank you.